Hey you guys, in this care plan, we are going to be discussing diabetes insipidus. What we're going to look at here is a description of diabetes insipidus. We're going to look at subjective and objective data associated with it, and then we're going to look at nursing interventions and rationales. All right, so diabetes insipidus is a condition where the kidneys are not able to retain water in the way that they should. This means that the kidneys are creating extremely large amounts of dilute and even odorless urine. And actually, they can have up to 20 quarts a day. So we're looking at a very extreme increased urine output. Normal urine output is about 1 to 2 quarts per day. And like I said, you can have up to 20 with diabetes insipidus. Because of this excess urine production, the patient becomes really dehydrated, feels very thirsty, and you can get some really abnormal electrolytes. Okay, so let's think a little bit about how this actually may happen. So the hypothalamus in the brain is actually what secretes a hormone called vasopressin, which is an antidiuretic hormone. So this antidiuretic hormone is actually what tells the kidneys how much fluid they need to absorb. So usually vasopressin is released from the hypothalamus when the body needs to retain fluid for some reason. So maybe they've lost blood, but for some reason the body needs more fluid. Now, if the hypothalamus isn't able to release vasopressin because it's been damaged, you get something called central diabetes insipidus, or CDI. And if the kidneys aren't able to respond to vasopressin that is in the body, you get something called nephrogenic diabetes insipidus, or NDI. So those are the two different types of diabetes insipidus to be aware of. But either way, what happens is the kidneys won't know when to stop removing fluid from the body, and the patient is going to have excess urine production. When you have this, you get diabetes insipidus. The desired outcome for a patient who has this diagnosis is to prevent dehydration, manage symptoms, and prevent complications. And often the complications are about those abnormal electrolytes that I mentioned. Okay, so let's get into the care plan. The subjective data that you're going to see with diabetes insipidus are excessive thirst, polyuria, so excessive urination, headache, fatigue, nausea, dry mouth, loss of appetite, muscle cramps, and confusion. The objective data that you will see with this diagnosis are, again, dry mucous membranes, tachycardia, weight loss, hypotension, hypernatremia, and decreased skin elasticity. And you can see how with both of these, they're directly linked to fluid abnormalities and electrolyte abnormalities. Your first nursing intervention here is to keep a super close eye on the patient's eyes and nose, their weight, and their level of thirst. Now, it's important, so important, that we know exactly what the patient is taking in, so their intake, and what their output is. We need to know every time they go to the bathroom, and we need to know exactly how much they're urinating. Also, remember that weight loss can occur with excessive fluid loss, and extreme thirst may be a clue that the patient's fluid loss has actually worsened. In extreme cases, if the dehydration becomes severe enough, the patient may actually show signs and symptoms of hypovolemia, and possibly even shock in really severe cases. So if this happens, you're going to notice changes in vital signs. So you're going to notice increase in heart rate. You're going to notice tachypnea as well, so increased respiratory rate, and a decrease in blood pressure. So we just mentioned that you might see a drop in blood pressure if they've got low volume. If this happens, it's really important to provide education and assistance with ambulation. So you want to be looking for signs like dizziness, and then really you want to educate patients on how to make sure that we can avoid falls as much as possible, and then they may need assistance with their ambulation. Okay, this next intervention is super important. These patients are going to need fluids. So we've got to encourage hydration and make sure that patients have access to fluids. Sometimes IV fluids are going to be necessary if they become hemodynamically unstable. All right, so we've been talking about fluid balance a lot, but next we need to pay really close attention to the patient's electrolyte balance. So the way that we keep a close eye on this is to check urine and serum osmolality as well as our sodium and potassium levels. When the body is losing an excessive amount of fluid, you're going to see potassium excreted excessively as well. So you're going to end up with hypokalemia. But the opposite of that's going to happen with your sodium, because your body's going to retain the sodium and you're going to end up with hypernatremia. So when you're looking at these electrolytes, you want to look for hypernatremia and hypokalemia. The next thing we may need to do is actually to give medications. I've listed the really important ones here for you to see. So the chlorpropamide may be given to stimulate the release of vasopressin. Hydrochlorothiazide may be given to treat nephrogenic diabetes insipidus, which again, remember, is when the kidneys can't respond to the vasopressin that's already circulating in the body. Aqueous vasopressin may be given to treat short-term diabetes insipidus, and the pitressin tannate is a long-acting vasopressin. Now, remember, anytime you give your medication, it's really important to monitor for the effectiveness of that medication. So we want to be looking for changes in blood pressure and changes in fluid balance. Okay, remember, these patients are at risk for hypotension and dizziness and electrolyte imbalances. So it's really important to include in your nursing intervention how to prevent injury and reduce the risk of falls. This means providing assistance to the bathroom and easy access to the bathroom as well. And lastly here, because of the frequent urination, some patients may actually experience incontinence. And if that happens, they are at increased risk for skin breakdown. Therefore, it's essential that we continually assess skin integrity and apply skin barriers as needed.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.